Thank you for joining us this afternoon. I'm Kelly Dean with WBKO. Since March, the Bowling Green Warren County Coronavirus Workgroup has regularly met to discuss the effects of COVID-19 here in our community, including strands on our education system, our healthcare facilities, our businesses, and the health and well-being of our citizens. Because we are experiencing a rapid and alarming escalation of cases, our community leadership has joined together to share an urgent message with you here today. COVID-19 is bearing down on our entire region more than ever before. The data we have received this week is more dire than at any point since the beginning of the pandemic, and our community must take urgent action now. I'd like to welcome first to the stage President and CEO of the Med Center, Connie Smith.
Thank you, Kelly. Good afternoon. As Kelly mentioned, hospitals in this region are under tremendous strain as the number of COVID-19 patients who are admitted is rising at a rapid rate. Since the outbreak of this pandemic, our Coronavirus Workgroup has been careful not to pull the alarm. But today, we are sounding the alarm. COVID-19 does not discriminate by age. Roughly a third of our COVID patients who have died have been in their 40s, 50s, and 60s. I want to be clear. Healthy people are dying of COVID-19. We're only 12 days into November, and Med Center Health has had 21 deaths due to COVID-19. Compare this to March, when it took 3 months to reach that same number. Every death is devastating to the families as well as the healthcare workers caring day and night for our patients. As this virus spreads, our healthcare workers are not immune. We have seen an increase in the number of employees who are sick and who are unable to work. Our caring and dedicated staff represent our most precious resource. We depend on them to care for all of us. Med Center Health and Greenview Hospital are in close communication with other hospitals across our region. We are all struggling with these challenges. Please take the comments you hear today seriously and help us control the spread of the virus. This is a marathon, not a sprint, and no one enters into a marathon planning to stop at mile 23. We must all keep pushing. We must not give up. A vaccine is in sight. Let's finish this together. Our lives depend on it. This time I'd like to welcome my colleague, Mike Sherrod, CEO of TriStar Greenview Regional Hospital.
Thank you, Connie. I do want to echo the words of Connie. This is a very serious pandemic, and it has changed drastically in our community. But I do also want to point to the fact that you do still need to search. If you need care, it's still safe to go to an ER, to go to the urgent care, to go to the doctor. One thing we can't do is not treat the ailments that are in you throughout the weeks or the days. The one thing I can't emphasize enough is the use of a mask. It's proven. We know that from the CDC. We know from healthcare providers. But I encourage you to use the mask daily. And it's something that's going to slow the spread of this. If we don't slow that spread, it's going to have an impact on our schools, our healthcare system, and our businesses. And I would challenge business owners, if your customers aren't wearing masks, I think it's at a point where they don't need to be served. We don't allow people coming into the hospitals. They're not complying with these strict regulations that we have. And it's going to take all of us to make that difference. The other thing I would suggest is we all have to make changes and differences. Thanksgiving's coming up, and we have to be very strategic in how we do our planning for Thanksgiving. We shouldn't be traveling. We should be in large gatherings. If we don't curve this before Thanksgiving, we are going to be in a lot of stress in our organizations, our businesses, and our schools in the next few weeks. And lastly, what I would ask is that everyone make it a point to make this a priority to make a difference in our community. Bowling Green is known to be a leader in many ways, and a lot of those things can be right here that we set the tone of how we need to do things throughout this region and throughout the state. So I encourage you to mask up, be social distancing, and wash your hands. Thank you. Next, I'll introduce Gary Fields.
Thanks, Mike. On behalf of the Bowling Green Independent School District, I want to thank you as a community. Your work and your commitment has allowed us to be in school in person since August 24th. That's a credit to our outstanding staff. That's a credit to our parents in this community. It's a credit to this coronavirus task force that has guided us in our decision-making from the beginning, from back in March. And most importantly, it's a credit to our students. I'm in our buildings every day. I see 4-year-olds and 5-year-olds in preschool and kindergarten classrooms wearing their masks, socially distancing, sanitizing their hands, washing their hands. I go to our middle school where I see 13 and 14-year-olds who tend not to always follow the rules, following the rules every day with their mask on, over their nose, keeping distance from their peers in order to be in school. And finally, I'm in our high school each day. The time of our lives is a 16 or 17-year-old. And students are coming on days maybe opposite of their close friends because they want to be in school. They are willing to wear a mask. They are willing to social distance because they know how important it is not only to get an education, but to be around their teachers and have that experience that many of us had great memories of. So I encourage you, if our students can do it, if our 4-year-olds and 5-year-olds can do it each day, and our middle school and high school students can do it each day, follow the lead of our students and our staffs, and do that when they're not in school, when you're out in the community, when you're at a store, when you're at a get-together. One of the great things that has happened over these last 8 months is 2 school districts, Bowling Green and Warren County, maybe always haven't been on the same page, but we have joined together to do this together for this community. And so I want to thank everyone for their support and to wear a mask. And I'd like to introduce my friend Rob Clayton, Warren County Schools.
Thank you, Gary. I want to take just a brief walk back to mid-March when the group behind me, along with a select few additional leaders, came together to not only brainstorm about the potential pandemic that was coming at that time, but also how could we collectively work together, collaborate with one another, and act very responsibly. And I want to share my sincere thanks to all the members of the Coronavirus Workgroup, but then also want to recognize everyone in this community that has done their part, made the sacrifices to not only ensure that we could keep our students in school up to this point, but that also we could continue to move forward as a community. From day one, this has been a community issue. It's not been a school system issue. It's not been a business issue. Everyone has been impacted by this particular pandemic. We've been encouraged by the response of not only our families, but our students and our staff, as both school districts here in Warren County have demonstrated that if we wear a mask, if we social distance, if we help each other be right, that we can be responsible and minimize and mitigate the spread of this virus. Our hospitals are accomplishing this. Our school systems are accomplishing this. As of this date, we still have no definitive information to suggest that there's been a spread of this virus during the school day within both school districts. And that's because of the fidelity of the safety measures. And so we're here today to ask you to please join us in cooperating with wearing a face covering and social distancing as best as possible, especially in light of the upcoming holidays. We're committed to providing the opportunity for our students to have in-person classes, but it's really up to us as an entire community. At this time, I want to recognize and introduce Dr. Phil Neal. He is the president and CEO of South Central Kentucky Technical and Community College.
Good afternoon, everyone. Like the others with me today, South Central Kentucky Community Technical College is committed to ensuring that our college provides a healthy and safe environment for our employees, our students, and our guests. And as we confront the challenges that COVID-19 has brought to our community, we know we're not helpless in this fight. We each have the responsibility as well as the tools that we need to keep this virus from spreading further. Now is the time for us to step up together and support our local hospitals and our frontline workers by tamping down the virus through compliance with the CDC regulations. Now, early in this COVID outbreak, our college, along with 15 other community and technical colleges from around the state, developed Healthy at Work plans that include a robust set of protocols to combat the virus. And after months of incorporating these viruses into our campuses, just like you heard from Mr. Clayton, we know that these regulations work. We also train a lot of the essential workers out there in our region in healthcare, and we want you to know that we stand with you, we're proud of you, and we salute the work that you're doing every day to keep us healthy. So I'm asking our broader community to continue the fight against the virus. We can continue engaging in many of the activities we knew before the pandemic if we just adhere to a few simple guidelines. That's wearing the mask in social settings. That's washing our hands in frequently touched surfaces. That's staying appropriately distanced from one another. But if we don't, we know exactly where that's going to lead. We've been there before. It was just a few short months ago when our schools were closed, our businesses, their efforts were curtailed, people lost their livelihood, our economy suffered, and people lost their lives. Let's not go back there. This is within our grasp. We can do this. In closing, I want to thank our hospital staff and all the frontline workers, our city and our county leadership, and this work group for all they've done to fight the virus and save lives. I'd like to invite to the podium the president of Western Kentucky University, Dr. Timothy Caboni.
Thank you, Dr. Neal. I'm proud of the work the WKU community has done to rethink the way we operate alongside COVID-19. From our offices, classrooms, residence halls, to our buses, dining facilities, and athletics, what we know and what we've seen across the state and across the country is this. You can redesign your operations and revamp the way you work, but unless we each make the decision to follow simple guidelines proven to mitigate the spread of COVID, none of this matters. Unless we each commit to taking action to protect ourselves and others, it's all for naught. We can only fight this virus if we fight it together. The reason we've experienced such tremendous success this semester at WKU is simple. Our faculty, our staff, our students took personal action to comply, to care for each other, to encourage each other, to support each other, and to speak up when needed. So on behalf of all of those at our university and the Coronavirus Workgroup, I ask that you, the citizens of Warren County and Bowling Green, do the same. We need you, every one of you, and all those who travel into our area, to take action now. We need you to wear a mask, and we need you to practice social distancing. By doing these simple things, the spread in our area can be stopped. We can relieve our healthcare system. We can keep our schools open. We can keep our businesses open. And most importantly, we can save lives. I'd now like to call to the podium Bowling Green Mayor Bruce Wilkerson.
Thank you. In the spring, Bowling Green and Warren County were spared some of the most negative impacts from the COVID-19 pandemic. Our community leaders that you see here came together and formulated a thoughtful, measured, and strategic plan that allowed us to successfully navigate several months with limited effects in our community. Now that paradigm has shifted. As you've heard, the toll that this virus is currently taking on our area, it's real, and our healthcare facilities are nearly reaching their limits. I often say that this is one of the greatest places to live in the nation, and one which you can live and work freely. And throughout my time in this area, we've witnessed countless times when our community came together and accomplished a goal far beyond what people think we could do. Today, I'm here to ask you again, once again, we must be vigilant and limiting those contacts and stop social gatherings that would cause the spread of this disease. We must wear the mask anytime we leave our homes. It's still possible to turn the tide and bring these cases to a more manageable level, but the time to act is short, and the time to act is now. These steps, although inconvenient, are simple and easy, and we've heard them over and over, and we ask for your compliance. I would like to introduce Warren County Judge Executive Mike Buchanan at this time. Thank you.
Thank you, Mayor, and thank you to all of the members of the Warren County Coronavirus Workgroup. Today we find ourselves where truly none of us ever wanted to be. For months, we've changed our habits. We've learned to live alongside COVID-19. The hard work done by this group, individually and collectively, and by you, the citizens of Bowling Green and Warren County, has created the opportunity for our students to return in-person classes, for our colleges to open and educate the future of our area, for our businesses to remain open, and for business owners to make a living. All that work is now at risk. Please hear me. We are facing a serious consequence if we don't change our ways. It only takes a few to make the difference and send us into a greater spiral. As you've heard, we are now completely within the virus's grip, and immediate action must be taken. We don't want our community to become like those communities that we've seen on the news at night. If you're a business owner and you're not enforcing the mask mandate, you're not putting your employees and customers first. You're putting them at risk. You are putting your own livelihood at risk, and you're welcoming a shutdown. No one wants to see an economic shutdown like we witnessed earlier. If you are carelessly going about your business every day with little regard for the power and potential of this virus, every point shared this afternoon should be a wake-up call. The kind of wake-up call that none of us want, the kind of wake-up call that our community now needs. Folks, I've heard all the arguments against COVID-19 precautions. I've heard people say, I don't know anyone who's ever had COVID. I don't know anyone who's died from COVID. But truly, we cannot continue to absorb this unprecedented increase in cases in our area. Our healthcare facilities are taxed, our public health infrastructure is strained, and each of us need thoughtfully to consider our individual actions and the effect these actions have on our friends, our families, and our citizens. I now would like to ask Kelly Dean to come back to the podium. Thank you.
All right, now we are going to open up this press conference to media questions. First, we have Rhonda Miller from WKU PBS. Rhonda, if you want to go ahead and ask your question.
Yes, I'd like to know if the hospital presidents can tell us how many COVID patients are currently in the hospital, and what's the capacity as far as beds and staff, and have they had to start recruiting staff from other areas?
Sure, we're going to stand apart to try to answer this question, but we have regional calls with our healthcare facilities, and today we just had one this morning. I think the number was over 100 in the hospitals, and that includes T.J. Sampson up to Taylor County and the surrounding area. Locally we have probably about 70 cases locally between the two hospitals. The biggest challenge is not so much beds, as much as it is staffing. Staffing or having the nurses and the caregivers, clinical and non-clinical, is an issue throughout the country. It's in the Southeast, and it's definitely here locally and throughout the state. That is probably our biggest barrier, because what's changed is our census dropped, back when the COVID started originally. What's happened is a lot of these cases were put off, people put off their health care, so now the acuity of the patients in the hospital are so much higher, excluding COVID, and then you layer in COVID on there. That's where the challenge is really occurred for Med Center and Greenview.
I would just add that we have brought in staff from other places. We do have, Mike and I both have brought in traveler nurses and respiratory therapists, and we've also redeployed some of our own staff that worked in non-bedside areas. So at this point, we have brought in other staff.
So it's about 70 cases of COVID currently in the hospitals and 100 regionally, including TJ Sampson?
Correct.
Correct.
Thank you. Thank you.
The next member of the media we have on is Michael Collins from the Herald. Michael? Is Michael here? I think you're muted, Michael. You can go ahead and type your question, and we'll get to that first. Next up, we're going to go to Katie Cook with WBKO. Katie?
Yeah, I have a question for the schools. Is there ever going to be any kind of threshold to determine if you guys open or close to in-person learning?
Mr. Clayton and I will try to take that together. There isn't a standard threshold. I think part of our decision-making for being in since August 24th has revolved around information from this work group. Has been very informative, as well as what we're seeing in our schools. So as Mr. Clayton said, we are not seeing a spread within our schools, but we are starting to be impacted by quarantines from contacts outside of our school. And so that's why we felt it was very important, along with this work group, to speak today, because it is beginning to have an impact on our ability to staff our schools, as well as the number of kids that are being quarantined outside of school.
Yeah, I think more specifically, and Gary and I, again, were a part of this from the very beginning back in March. The two primary metrics, we look at a lot of data. Obviously, local internal data is most important once we open the school doors, but of course we had to make a decision prior to opening based on the community data and then the advice and guidance from the experts here locally, along with those experts across the state and across the nation. And so the two metrics that really stand out, first and foremost, the hospital capacity. We know that our rights start to be questioned when we start to infringe on the ability for others in this community to receive health care. So we greatly pay attention to the healthcare capacity and that strain, and then the other piece that Gary mentioned about the quarantines in regards to staffing. And we've each experienced 2 or 3 challenges in regards to being able to adequately provide the necessary staff to encourage and continue the teaching and learning.
I have a question for Mr. Collins. From the WKU College Heights Herald, and a question for Dr. Caboni, although this would be a good question for both of our hired leaders. What does next semester look like for WKU? Are any additional steps being explored should cases continue to rise in Warren County?
Next semester, what will that look like?
Appreciate the question. We have a dashboard that we look at, and one of the things that gives me great confidence about the work we've done so far at WKU is that we've had no transmission within an instructional setting. That means in our classrooms, our students, our faculty, and our staff are safe. And I would say that if you look at the case rate on campus versus off campus, it's a lot safer for folks to be at WKU than perhaps even out off the Hill. And so we watch that very, very closely. Right now, we have about a third of our courses in person, a third online, and a third hybrid. It looks like it's going to be similar to that in the spring semester. And what that does It gives our faculty and our staff some choice, and it gives our students choice of the modality they want to use. So I don't anticipate any significant changes, but we will watch every day, every week, the cases in Bowling Green and Warren County and our other communities. Because what is paramount for us is the health and the safety of our students, our faculty, and our staff. That'd be a game time decision closer to January, but my hope is that everyone in the community understands the challenge we face now, that we will wear our masks, we will social distance, we will wash our hands, and that we can get through this together. So.
We would have a similar answer at SkyCTC. We are prepared to go completely remote if we had to. We've done it before. We've prepared just in case, but we do hope that we can get our hands around this virus and curtail the inclines in caseloads so that we can continue to have classes like we have this semester, where there is, just like Western Kentucky University, a mixture of courses in an online setting as well as hybrid on-campus offerings. We too at SkyCTC, just like you heard from Mr. Clayton and Dr. Caboni, are strictly adhering to the CDC regulations on mask wearing, social distancing, frequent cleaning, and we have yet to find a single case of transmission between students and or employees while on campus. Every one of the cases so far that people have contracted the virus from outside locations, and so I say that to say many of us have been doing this for many months, and these protocols work if we just adhere to them. And I'm sure many of our viewers are in companies and organizations that have experienced the same thing. We just need all of us on board doing this.
I have a question for the county and city. Last week, I spoke with Judge Buchanan about possible enforcements that might be brought to either businesses here in the city of Bowling Green. Judge Buchanan, I don't know if you can talk a little bit more about the possibility of those enforcements and what those enforcements would look like.
Yes, the city and the county have both been meeting together along with the governor's office in regard to enforcement efforts locally. The state has enforcement, but they don't have enough enforcement to enforce compliance within every business in every community out of 120 counties. So we're going to take the lead in this area, and we're working out the details now. But factually, it doesn't take but one or two reckless or careless people to spread this virus. So we really need compliance with all of our businesses and all of our citizens. This is not a joke, and it's not political. It's a matter of health and safety for our citizens. Mayor?
If I could echo the judge's words, is it not being a joke this time? Most know me that I'm in the slow to accept crowd when it comes to issues like this, that we're at that point where when the hospitals tell me that they're running out of room for all of their patients, not just COVID, it's time that we have to step up. I'm afraid that we'll have to assist people in the businesses to come into compliance, and as a former cop, sometimes that means enforcement, but we want to do it from a voluntary standpoint, but we're going to have to do something. I apologize in advance, but we didn't bring this virus here, but we're going to run it out if we can.
All right, the next member of the media that we have on for a question is M. Brooks. Is he still on? M. Brooks, if you want to go ahead and type in your question and we can circle back to it. We'll go now to Laurel Deppen. Laurel, if you want to go ahead and type your question in as well. And then finally, we'll go to Aaron Mudd with Bowling Green Daily News.
Yes, this question is for either the mayor or the judge executive. Can either one of you speak to just the level of compliance with mask use that you are seeing within the community?
The places that I have been out have for the most part been in compliance. I made a few trips today just expecting a question similar to that, Aaron. And Walmart on Lover's Lane, I went in there and spent 15 minutes or so, saw nearly 200 people. And it wasn't until I started out the door that I ran into 3 or 4 that were not masked. So people, for the most part, are doing it. I think where we find most of the non-compliance is probably in a situation where it's more of a social gathering. I haven't seen an issue, particularly in restaurants, but I suspect that bars are a more social atmosphere than somebody going to get their groceries or filling up with gas and that sort of thing. Judge, have you had similar experience?
I've had a similar experience, and I don't think that most businesses are out of compliance. I think most people are trying to do it, but I've been to one restaurant where there was no one complying in the restaurant at all. I've been to a number of other places where, in restaurants where I've seen bars that are filled 3 people deep and shoulder to shoulder. Those type of things can be enforced by management, and that's where they should be enforced. But those type of things are exactly where we're seeing that level of spread occur. And once it starts there, it really doesn't take much for one person to be careless or reckless to spread it among thousands of people in a very short period of time. So we ask everyone to be conscious of their actions, not only about your own health and safety, but about the health and safety of everyone else around you.
All right. I have one more question, and then we will go ahead and wrap this up. Last question's concerning the COVID-19 vaccine. Are there preparations for the vaccine here locally? Who gets it first? I know we've heard a lot of different things about healthcare workers getting it first. What would that look like? And then we're also hearing that the vaccine will include 2 doses. So I guess more so a broad question about the COVID-19 vaccine plans for here locally.
We've been working with their entire region and with the state association to be prepared. We've had conversations with Dr. Stack, the public health commissioner, and we do have storage capacity that we can receive large volumes of vaccine here locally, and that we could help facilitate out to the region. But very specifically, some things have yet not been determined. The one vaccine that we have been made aware of, it is 2 doses, but some of those specifics have just not all yet been determined. But we are ready. That's one of the light at the end of the tunnel that we're very encouraged with, and we will do our best. And we've got a commitment from the entire region to do whatever it takes to be sure that we get the vaccine here and can administer that quickly. I was trying to think of the other part of that question. Mike, you want to?
Yeah, I think the other one is timeline, and I think one thing to emphasize is that just because a vaccine's coming doesn't mean we go back to either our current or old ways, because this is something that when you think about getting this to the population, the ones that need it the most, healthcare workers, seniors, and work down, it could be into the summer or later potentially, and that's what we don't know. How many doses we're going to have? How is that going to flow out? It is going to be challenging. So that is something we got to work out. So I'd say there's definitely hope coming, but I think that we still have to do the basic stuff we talked about today, and the hospitals will generally be the ones housing the vaccines and using those to disperse, not only in Warren County, but the region.
And priority for receiving the vaccine, who would that go to?
The details aren't perfect on that, but it's going to be frontline healthcare workers. I'm not a frontline healthcare worker, so I won't be one of those. I may be coming up, but really it's going to go to seniors and those at-risk populations first, and then it will trickle down through there. This is the way the commissioner and others have explained it to us so far.
All right, we will go ahead and wrap this up as the governor has his daily press conference going on right now. Just remember, stay safe, wear your mask, remember to socially distant from one another, and be smart. Thank you.